the consideration really is looking at treatment protocols where we want to start with the least aggressive therapy that has the greatest benefit, and we kind of move our way up in terms of more aggressive therapy if patients don't respond. I would say about 90% of my patients respond really quickly to two therapies that I use in conjunction with each other. The first one is called neural therapy. In the Western world, it's pretty synonymous with trigger point injection therapy. Again, that's trigger points, or a trigger point injection. For example, when you go to a massage therapist and they find a trigger point, a lot of times they'll kind of work into a muscle that's really knotted. It doesn't take much pressure to get patients feeling that trigger point. And what I describe is it's really hard sometimes to get that trigger point to resolve by working on it from the outside. When you do an injection into the middle of the trigger point, it's much easier to basically dissolve it and get that muscle to relax while you're actually injecting into the tissues. So again, that's neural therapy or trigger point injection therapy, and what you do is you use an anesthetic called Procaine. Procaine is the only anesthetic in its class. Yep, only anesthetic in its class that will break down the natural properties. There's no chemical breakdown or any liver detox. It's all nutrition to your body. What it does is it resolves those pain patterns and gets those tissues to respond. Another piece of the puzzle when we talk about neural therapy or trigger point injections is actually injecting between the first two skin layers. So what we'll actually do is we'll inject what we call intradermally. What that does is it pops up like little mosquito bites on your skin. The vast majority of your nerves and your nerve tissue lies between those first two skin layers. When we talk about pain patterns, there is something interesting that happens with what we call neuroplasticity. Neuroplasticity is a theory and a thought process as to your brain starts to create these pain patterns, and they constantly are in this nervous system loop. What happens is that your brain will continue to say, you have pain here, regardless of whether there is an inflammatory or acute issue going on, and that's a piece of the chronic pain patterns that we've been talking about. So when you inject between those first two skin layers, what it's doing is it's helping the brain recognize, oh, I don't need to hurt here anymore. So we're actually really hitting the reset button for the nervous system.
Yes, I'm familiar.
Yes.
And we did that for a number of reasons together for me.
Yes.
But one was a chronic headaches.
Yeah.
And it actually really helped
Yeah.
cut way down on my chronic headaches.